Hello, my name is Chris Brickman. I'm the Director of Global Health here at the University of Toledo. I also happen to be the Chairman of the Department of Emergency Medicine and also the Medical Director of the Emergency Department here at the University of Toledo Medical Center. I want to take you along for a little ride with me here. We are going to be showing you ways in which our simulation center is redefining healthcare. Now, I know that's a bold statement. Let me define that a little bit further for you. Let me take you back to the airline industry. In the 1940s, 1950s, how did people learn how to fly? Well, they learned how to fly by flying airplanes. And a lot of airplanes crashed. And a lot of people were hurt, a lot of people were killed, learning how to fly airplanes. Well, those days are over in the airline industry. How do people learn how to fly now? They learn in simulated settings. They learn in simulators. And that's where the majority of the flying occurs prior to anybody getting behind a real wheel of an airplane. So in medicine, why aren't we doing what the airline industry does? Currently, right now, we're still doing the same things that we have done for the last 100 years. The teaching methods of do one, of see one, do one, teach one, are still being practiced today, everywhere, all over the world. But we now have the ability to change that. And that's what the Simulation Center is all about.
The Interprofessional Immersive Simulation Center is unique in that it has three components. We call it a tri-center model. The three components are having an advanced simulation center, which has simulation models and simulated clinical settings. The Progressive Anatomy and Surgical Skills Center will offer unique opportunities for surgeons and other people who do procedures to patients to practice without fear of hurting a patient. And then we have a virtual immersive reality environment, which provides tremendous opportunities for new ways of teaching. In this virtual immersive space, we can take Frank, our skeleton, and we can move him around, manipulate him. So the versatility of this teaching model is absolutely phenomenal.
Hopefully you've had an opportunity now to see a little bit of the potential that simulation medicine provides us. Specifically, as we look to South Africa, I think the possibilities are enormous. As I see simulation medicine and what it could potentially do for us here, would be to bridge the limited resources that clearly exist throughout Africa, not just in South Africa or Sub-Saharan Africa. In simulated medicine, we should be able to significantly condense the education time that's necessary for us to teach both anatomical skills, surgical skills, medical skills to all providers, throughout the country. It's been a revealing exercise that shows you where the future of our healthcare education, training, and healthcare practice is going to be. I've hopefully been able to show you the way in which we use multidisciplinary specialties to work together. Nurses working alongside physicians, medics, pharmacists, the entire collection of healthcare providers that are necessary for a healthcare system all work, collaborate, develop, and train in the simulated environment. This is doable. This is something that we can make happen in South Africa. And it clearly is a possibility that is going to change the future of healthcare in Africa overall.